My name is Heather O'Beer, so I'm a district nurse with Yucaipa Cal Mesa Unified School District. I think it's in my 19th or 20th year in school nursing, so been around for a while. I did this presentation at CSNO, if any of you guys were at CSNO, and then I did it again in May for the California Department of Public Health. And then we were kind of talking about what we wanted to do for for our conference this time. We just thought that asthma is such a hot topic, and there's a lot of good information. I'm kind of living through an episode that happened, and so I'm here just to share that information with you guys and kind of give you tools so that you can actually educate your staff and we can work together. So this is, I'm going to show you guys a short video. This is the effect of asthma for a family, a school, and a community. I do always like to throw out the disclaimer that I was not the district nurse at the time when this event occurred. So let me. We just have the YouTube stuff we got to go through, right?
On the afternoon of Halloween Day 2019, this 13-year-old girl, 8th grade student at Mesa View Middle School, Adeline Carrasco, died from an asthma attack that she suffered on campus. She was in the hospital for 9 days. The doctors declared her brain dead, and her family made the very hard decision of taking her off life support.
She was a beautiful, giving, courageous, sweet little girl. She was a daughter, a sister, a cousin, a niece.
So this school district actually had protocols in place to help asthmatic students like Adeline in the event that they were having an asthma attack. The school on this particular day, unfortunately and tragically, didn't follow their own protocols.
Adeline was an asthmatic child. Every year, as a parent of an asthmatic child, you have to fill in a form. You have to inform the school any medical condition your child has. The school then transcribes that into your child's school record. As we started litigating the case, we started taking depositions, we start seeing this laundry list of failures.
They were coming up with every excuse not to take responsibility, but the overwhelming evidence at the end of the day was that it was solely their fault for what happened to Adeline. The family insisted that non-monetary conditions be part of any agreement to settle the case, and that's what we were able to accomplish with the school district. They also dedicated a mural on campus in Adeline's loving memory. She loved butterflies, and so the school decided to put up a beautiful piece of artwork in Adeline's memory.
I actually have a daughter that is the exact same age as Adeline, so as we're working on this case, I keep seeing my little girl, because as a parent, you drop them off and you expect to pick them up.
The lasting impact of this settlement is that students with asthma are going to be safer at school now. That's the bottom line.
Still clicking?
Oh, yeah, okay, perfect.
All right, so sorry to start it off with a somber mood, but I think it kind of just puts everything in perspective. This could have happened for any one of us, right? It could happen at any day on any of our school campuses. This happened in 2019. I came in 2021. So we're still building up those processes to protect our children with asthma at school. Just to give you a little background, we can talk about the case because it's obviously been filed. I'm sure you guys all heard about it because it's on national news. $15.7 million payout, I think, is what the district had. Some of that also was we had to contract with a pulmonologist which has actually been really good for us because now I have a pulmonologist that I can call and ask questions for. I can refer students to, things like that, working on our policies and our procedures. So all those barriers you guys are coming up against when you're trying to work with your school staff, with those administrators, it actually opened doors for us and it's actually made it a lot easier, but unfortunately due to the tragedy of the loss of one of our students. So it happened on Halloween. I think that's really important for you guys to know because as we know, asthma and allergies go hand in hand, right? And the doctor is going to kind of talk about that a little bit later. So the question is, you know, was it actually anaphylaxis that threw her into, you know, that triggered her asthma, that, you know, caused the event to actually lead as far as it did? What happened, in case you guys aren't familiar with the story, is that obviously it was Halloween. They were doing a project, something with pumpkins or something out on the PE field, on the PE grass, like way out on the field, science class. She started having trouble breathing, went to her teacher, told her teacher. The teacher told her, you know, asked her where her inhaler was. It was in the classroom because obviously they were out on the field. So the teacher sent her with a buddy, thank goodness, but did send her with a buddy, back to the classroom, which it was a pretty far walk. So she walked from the field back to the classroom to get her inhaler, used her inhaler, walked back down to the field, was still having difficulty breathing, told her teacher, I'm still not feeling right. She actually called her mom on her cell phone as well, told her mom she wasn't feeling good. She'd used her inhaler twice. She walked up to the health office. We do not have RNs like most of you guys don't. We did have an LVN on the school site, which was good. So it was pretty much as soon as she walked into the health office is when she collapsed. So they did have to perform CPR on her. You guys saw the pictures of her in the hospital, and then she did end up passing away. So one of the questions and one of the things I've worked with the pulmonologist on is when we're developing our asthma policy and kind of fine-tuning it, is you know, giving the epi. You know, would it have been appropriate to give epi at that time because she had signs and symptoms, right? So that is something that he does feel strongly about, is adding that epinephrine into our asthma policies. If they have these signs or symptoms and they've used their inhaler and it's not working, we're going to give the epinephrine. So any questions about that, about the episode that happened before we move on? Yeah, Michelle?
So my question then is, if your policy, your standardized policy is going to be that, then our parents are aware, those that have asthma, that if it's unresolved?
I'm assuming they will be notified of that. I mean, we're still working on the policy and, you know, we're working with cabinet and our lawyers and everybody like that. So it is still a process, so.
Because I know it's not typical that you give the inhaler and then it's not working, we're gonna call 911, but I would have never thought to give epi, because you're saying the symptoms were there, but I don't hear that the symptoms were there, just the respiratory.
Well, but she was having difficulty breathing, you know what I mean? She was, obviously, she was short of breath, you know, I mean, I wasn't the one assessing, but I just know that they said the symptoms were there, so, yeah.
Well, I can say, Reno Valley, I've actually given EpiPen more for asthma attacks than for food allergies.
Okay. Is that part of your standard policy, or is that just something
It's written into our health plan,
okay.
that if, they have these symptoms, then they may need an EpiPen.
Okay.
And so I've given 7 EpiPens for asthma.
Wow,
I've been there 19 years.
amazing, yeah,
So, to be honest, I personally, and my health techs have given more EpiPens for asthma-related symptoms than for food allergy.
Are you using the stock EpiPen or is it?
Stock EpiPen, yes.
I would cover that,
Yes.
yeah.
Yeah, the stock order ours has it in there for
yeah.
asthma induced.
Did that student have a health plan?
So that's the other thing, is we were working with them on getting orders for her, and the parent hadn't brought in the orders for the inhaler either.
So what were all the
She used
failures
her inhaler.
identified?
Huh?
What were all the failures identified?
So the teacher sending her, like not calling immediately for help. We'll talk about some of the practices we put into place, like, you know, if the student's in trouble, they're calling on the radio. Like if the teachers are ever out on the field, whether it be PE, if they're taking their children away from their classroom, they take their radio with them.
They have radio.
Should they have to take, you know, should they have to call, then they have the golf cart, they would come and actually pick up the student to take the student up there, or bring the nurse to the student depending on, you know, where they were located and stuff like that. So that was the biggest failure, was it did fall on the teacher, because she sent the student back, you know, student came back and she had the student walk. So they talk about, they actually tracked, like they came out and they tracked how far the distance she came, and that's pretty much what threw her over the top, was the actual distance that she was, because it's a big campus. It's a middle school campus, but it was built for a high school, so it's really big, and so she did travel, you know, she did travel quite a bit.
So how did she use her inhaler if you guys didn't have orders?
She had in her backpack, like the kids, you know, we're not aware of the kids that carried in their backpack, so she just had told the teacher, oh, I have it in my backpack, and she went and got it, and then she used it, so, yeah. I mean, I'm sure you guys all have those kids, right, that are carrying it, that we don't know this, and that's the dangerous part. That's the very dangerous part, yeah, because they don't have plans, yeah.
Question, so this student, and especially the students there in Moreno Valley as well, do they have a known allergic response to something, or is this just something that's brought up and just?
She didn't, no, she didn't, it was asthma, so I mean, but they're having signs or symptoms, but because and I'm sure the doctor, we can talk with the doctor more when she comes in, because I know I saw her slide, she's talking about the anaphylaxis too, and kind of how they go together. So I think that, you know, she'll probably be the best one to answer that, but she didn't have, she was, we knew she had asthma, but again, trying to call those parents, hey, do you have orders, do you have orders, do you have orders, and not getting those orders for it. So like they said, we have policies and procedures in place, but they hadn't followed what those policies and procedures were in the place.
I guess I'll ask the doctor too. So the clinical logic for epinephrine for this asthma is the airway constriction. So it's anti-inflammatory. Epi for asthma can open that up for oxygen. Okay.
Yeah.
And I was just gonna chime in, I believe if you look for the stock epinephrine, there's a whole packet that you can read through if the district, you know, if your district ever decides to have stock epinephrine, stock albuterol, but in there, it does give guidance for using both and when to use it. So there's actually one page on it, if you look through it, it's a very long packet of how you would implement that program, but it is on there, and if I can find the packet link, which I believe I saved, I can send it out to all of you too, because it is worth reading, because one day we probably will go to having
Does
stock
anyone have
albuterol.
stock?
We're looking at it now
I'm sure you
because
are.
of everything, yeah, but they kind
Yes.
of were pausing about it at first, and then the pulmonologist and I were like, look, like, you want us to do all this stuff, why are we not doing this? And it was mostly cost related, like,
Yes.
how are we gonna pay for it, the spacers and all, so we broke it down, and, you know, using, Medi-Cal, you know, stuff like that, I'm like, here we go, like, we're helping, it's to benefit the students, so we're working on that process right now. So we're working on that policy, to go along with our asthma policy as well.
Yeah, because I don't know any school district that currently is using the albuterol.
So Victor Valley Elementary does, if you guys want to contact the nurse up there, because I was from the High Desert originally, she implemented it in her district. So Victor Elementary.
Good to know.
All right, so just some rates of, it's kind of common knowledge for you guys, but in 2021, there were 38.7 of children ages 18 and younger who had asthma reported having one or more asthma attacks in the past year. About 63.1% of children under the age of 5 with asthma has had an asthma attack. And then according to CDC, asthma attacks in children have declined from 2001 to 2020, so that's good, probably because more education and just more kids are getting some more medical care and things like that. But even though asthma is controllable, it's estimated that 50% of children with asthma do have uncontrolled asthma. And I don't know how close you guys are to the fires. Obviously, we're in Yucaipa, so our school, we shut down for 7 days. We were shut down a whole week, and then it went away, and we came back, and then we came back, and we were shut down for another 2 days because the air quality was so poor. So that was another good thing that came out of this, is we actually we have a person on our safety team at the district office who monitors the air quality control, and who's very adamant about putting out those notices and saying like no outside sports or activities, you know, and so they really, I mean, 7 days of school is a lot for them to consider shutting down school, but because of, and I know the doctor has it in her presentation too, talking about the wildfires. So that is something that we've experienced a lot from the wildfires that we did have. So we had a lot of our kids, asthmatic kids, they didn't even come back to school. Some of our kids missed 3 weeks total because parents are like, I'm not sending them. They've been out of control with their asthma. They're getting, you know, treatments and stuff like that. So they just didn't even want them coming to school. So just some stats. I know the doctor also has, our slides kind of have some of the same information. So, you know, there's 1 in 7 people in California have asthma. It talks about how much it costs, about $13 billion per year. These are just stats as it looks at the different demographics as far as our Blacks and our Hispanic children. And, you know, they have poor access. You know, part of that is poor access to healthy and affordable housing, quality food choices, healthy schools and quality education, and then quality health care. And so on average, 3 children in a classroom of 30 are likely to have asthma. So this is something I tell teachers too when I'm doing my teaching with them is, you know, some of them may even be undiagnosed. You know, some of them parents may not want us to know that they have asthma because they don't want, you know, their children targeted or whatever. There's different reasons for them doing that. But teachers do need to realize that, you know, that in a class of 30, you know, there's about 3 of them in there that could possibly have asthma. So asthma capitals in California. So Fresno's rated 5th, but I highlighted because we're in Riverside. Riverside's actually 54th as far as being the asthma capitals in California. I was super surprised San Bernardino was not on there. I was like, we've got LA, San Diego. I was like, where is San Bernardino? But they weren't on there. But again, that's due to, you know, there's lots of farming in Fresno, you know, so it has to do with that, low socioeconomic status, you know, the poverty, the pollution, and just all of that other stuff contributes to that. But I was interested that Riverside was actually 54th, LA 62nd. So, you know, kind of interesting. And then there's, just so you guys know, there are California laws and bills related to asthma. I know if you go to CSNO, they do talk about like lots of legislative stuff that you guys may not be aware. So there's Adeline's law, and then there's also obviously we know the emergency stock albuterol, which was passed October 8th of 2023. So Adeline's law is the little girl that passed away in Yucaipa. So it is still in the process of, you know, being passed through everything. I think it's at the review stage. As you guys know, it goes through multiple stages, but it has not been kicked out yet. So that means that it is still in the process. So it would require school districts, county offices of education, charter schools to, upon receiving a notice from a parent or guardian that a pupil has asthma, to create an individualized asthma action plan for that pupil. We all know how hard those get, right, in the first place. The bill would encourage, and I highlighted the word encourage because, you know, we're all big on the lingo, but it says encourage, so it doesn't say you must, local education agencies to provide professional development for school staff that includes, among other things, information about symptoms and common triggers of asthma. So this bill is still up there, like I said, being reviewed, but this was something that the parents, again, they felt very passionate about. I mean, they lost their daughter, but they're also trying to make changes. They're trying to help other students. They don't want another parent to have to suffer the loss of their child. And then you guys know about the stock albuterol one that was passed. So the ones in the blue are the ones that have active ones. California's not on there because it was just so new. When I did the slide, it wasn't on there yet. And then there's also federal legislation, initiative on asthma management in schools, and this was in 2021. So the School-Based Allergies and Asthma Management Program Act was signed into law, and it encourages states to improve asthma care. It provides grants to adopt certain asthma management plans and policies. It requires states to allow stocking the albuterol in schools. And then it lists the different things like those individualized education plans or student action plans. School nurses or trained staff on site during operating hours to give those medications for asthma and for allergies. Education for school staff, efforts to reduce environmental triggers, and then support for families managing asthma and allergies. It's also part of the Healthy People. So as you can see, like asthma's out there, so, legislation at the state level, at the federal level, they're pushing it. They want to reduce hospitalizations for asthma in children under 5 years old. They want to reduce emergency department visits for children under 5. They want to also reduce the amount of asthma attacks. So what does an asthma attack sound like? This is something that I include with my staff training that I do for my health technicians in the school health office.
Grown brilliance. Exquisite lab-grown diamonds. Brilliance is when every facet.
Again, just another teaching tool. Some of the stuff I've included are things that you can also include, with staff teaching, but I think it's really important that they understand how, asthma can present differently. So many people think, oh, wheezing, and that's just kind of what they go off of. But actually, when that airway is closed, when it's constricted, you're not gonna hear those breath sounds at all. All right, so now you guys all have little straws on your tables. This is another thing. I use this when I do my teaching with my staff teaching for my teachers as well. So it's just to kind of show you what it's like to have asthma. If you have asthma, don't do it. I don't want you to have an asthma attack here, okay? Even though we're in a room full of nurses, all right? So if you just take your straw and just breathe through it, like suck air in and breathe it out, you can feel how easy, that air is moving in, it's moving out. Now take your finger and just close off just like part of it, and then try to breathe a little. It's kind of hard, right? You're like trying to suck in. It's kind of when you get that thick milkshake. I feel like you're sucking in that straw. Now close the whole thing off. Put your finger on it and really try to breathe in. And that feeling. And so that's what our students, when those lungs are completely closed, that's what they're feeling. So if you don't have asthma, this is a really good, tool to just kind of explain to people, this is what your students are feeling like. This is what it feels to feel asthma. How does it feel to not be able to breathe? You're like sucking in, and when I did it, I actually can use the little coffee stirrers too, because they're even thinner, it's kind of as it narrows, it gets thinner and thinner. Sometimes I'll use that as well. But it's like, when I did it for the nurses at CSNO, they were pulling it away. And I was like, what's wrong? You can't breathe? And it's that's how our students feel, that panic feeling. That's why some of them, they do go into panic attacks and things like that too. But that feeling of not being able to breathe. So guys, buy yourselves a bag of straws and, go out there and you can teach your staff, what it's like to not be able to breathe. So through this process, I told you guys, they came to me and this is what happens, this is what happened, we need to fix it. And so we had to start with how are we going to go through this process of making sure our kids with asthma are safe on our campuses. So first of all, you have to do a needs assessment, like what is the need? So just kind of, we'll go through 1 to 10 and we'll kind of just rate your districts. But these are the questions that I had to ask as well is, does your district have asthma policies and procedures? So who's like on a 1 to 5? You're like, yeah, we do, but they're not the best. Or 5 to 10, you're like, yeah, we got awesome policies and procedures. Yeah, you guys feel pretty strong? What about the rest of you guys? Do you not have them? Are you 0? Do you have no asthma policies and procedures? All right, I'm going to tell you what my results were on the next slide too. What resources does your district provide for asthmatics? So do you guys have resources that you provide to your asthmatics? Like places you can refer them to, mom comes to you and, oh, my child just got discharged from the hospital, they have asthma, where do you guys tell them to go to? No? Primary care, right? And then how are staff informed of asthmatics on campus? So how are your staff? How do you inform your staff of the asthmatics, those teachers? How do they know which asthmatics? How does that PE teacher who's taking that kid out on the field and is going to make them run the mile, how do they know that they have an asthmatic in their class? And then the next one is, does your district provide asthma training to staff? Just by a raise of hands, like besides your health service staff, how many of you guys provide asthma training to like your teachers, PE teachers, any other staff? So not a whole lot, right? Few, just a few. All right. So the results of the assessment I did for our district was the only policies we had in place was basically ed code that basically talked about them being able to carry their inhalers. That was the only thing that we had in place. We had no standard policies and procedures that said, if you see this, do this, or anything like that, which is what we're still writing. I mean, we started this in 21, kind of 22, we're still building on it and still trying to write it and still trying to refine it. And then what resources did we have? We had none, like you guys all said, primary medical doctor, right? That was all we had. We didn't have any resources. Where do you send your kids when they need help with their asthma? If it's uncontrolled, you're seeing them in the office every single day, where are we sending those kids? How do we get the information to staff? So we use ARIES. So that medical information was entered into ARIES, but talking to teachers and staff, a lot of them were like, well, I don't have time to go through all my kids. The middle school, the high school level, they were like, how do I know? It's like they're flagged and everything like that, which I'm gonna talk to you about how we kind of fixed that as well. And then the PE teachers were the biggest because they're like, well, I don't take my Chromebook out on the field. They're like, I have my list, so I don't know which kids have asthma or not. So that was another thing that we fixed. And then what training was provided, again, kind of similar to what most of you were. There was no training provided other than to our health services staff. So then we needed to identify our next steps. So that included meeting with the key players. So that included the superintendent, the assistant superintendent of education, and the director of student services to discuss what the needs and priorities were of the district. So just me talking to them about what are your priorities? Where do you want to start? Once I did the needs assessment, what parts do we want to fix first? What are we going to work on next? And then of course we had to implement those things. So policies and procedure, the first thing we wanted to do is they identified PE as a priority because as we know, the kids are out there, they're running the mile, they're exerting themselves. They're like, I really feel that we need to use PE as our priority. So I worked with the health office staff, I worked with the PE teachers to develop a procedure for asthmatic students during PE, and then I trained the PE teachers. So we'll talk about how we kind of did our things in ARIES, but they have a sheet now, a paper sheet, that they can take with them. It has an M next to their name, so they are responsible once they print out that sheet to go into ARIES and to look at just the kids that have M's that are identified so they know which kids have medical conditions, because I explained to them, we're here for asthma, but you have kids with cardiac conditions, with seizures, with all kinds of other stuff in your class that you really need to be aware of, especially if you're out on the PE field away from, very far away from the health office staff as needed. And then I did work with them one-on-one, and I did training with them, showed them, how students should be using their inhalers, talked with them on how to make sure they're using it the right way, when they should be using it, when they should be calling 911, and when they should be, how to send them to the health office and things like that, yeah.
Did you guys get nebulizers after this?
No, we don't have nebulizers, no. The pulmonologist I'm working with, he feels that if they need a nebulizer, they're sick enough to be, like, they should be at home. Like the use of the nebulizers, he's like, if they have a nebulizer, they're not stable. Like usually when we write orders for nebulizers, it's every like 2 to 3 hours or something like that. Like they're sick, like they need to be home. They shouldn't be exposed to other kids and things like that. So we didn't implement the use of nebulizers. So this was our PE asthma care protocol that we came out for elementary. So basically it says all PE teachers must carry their radios with them during class time. So I don't know how your PE teachers at the elementary work, but ours kind of travel around to the different school sites. And then they take, certain grade levels out and things like that, but they weren't taking their radios out with them. So we made sure that that was part of the policy. They need to be aware of their students that are in areas that have medical conditions, especially, our asthmatics. And then, it's like I got a glare. In the event of an asthma attack, the PE teachers will radio for, and our terms are the ones I use, is yard duty aide or a health office or administrator to assist in transporting the student to the health office. And then student is to never be left alone. That was one thing that we really pushed hard, is never, ever, ever leave that student alone. And then if they have any of those signs or symptoms, they're to call 911. So struggling to breathe, unable to catch their breath, severe chest tightness, lips or fingernails turning blue, or a loss of consciousness. We did this for the secondary school. At our high school level, again, the teachers weren't always carrying their radios with them. But the biggest problem we identified was that the PE teachers, like a kid's like, oh, I left my inhaler in my locker, so they're not even taking it out to PE. So one of the things we did implement, because of the uniforms that they have to wear, the shorts they have to wear, is that the students were allowed to wear the same color shorts with pockets so that they could actually carry their inhalers, or even for our diabetics, that they can carry their monitors in their pockets as well with them. And then the other thing is that if their students, needed to go back to the locker room, they were to call for assistance, because some of the kids are like, no, the locker room's locked, so then they couldn't get in, so they're to call for help. Someone's to escort that student to the locker room. If they're in distress, they're to take them, straight up to the health office. We're not gonna, worry about all that. But the big thing is that
Sorry, that might be our police department with their recruits.
I was like, what is going on?
Our ROTC, I'm not sure.
I was like, oh my goodness. That's okay. So basically, never to leave the student alone, and then the same things, the same guidelines for when they're to call 911 as well. And then another thing we implemented was, what we were finding is our kids that have the self-carry inhalers, is that, the doctors were just checking off, yeah, they can self-carry, but who's monitoring that they really know what that means? Like, are they competent? Was this girl who had her inhaler, the one that passed, did she know how to use it? Was her inhaler expired? Did it have any doses in it? Those are the questions that come to mind too. Again, I wasn't there, so I can't say whether or not those things were part of it. So we have this checklist. So if a student comes in and they have the order to self-carry, before we allow them to self-carry their inhaler, and this is done with the parent, is going to be the parents there, the students there, and our health techs are there. So they're doing all of this before we check it off. So is the student able to identify the correct name and dosage of medication? How many puffs do you do? What medication do you take? And we're not telling them, we're not teaching them during this time. They're showing us, because they need to demonstrate their competence. If they aren't competent, then we then teach them, and we're like, okay, let's come back next week and we'll go over it again before we actually sign them off. And then the student's able to demonstrate where to locate the expiration date and the number of remaining doses on the inhaler. How many of your kids have you found that have expired, medication on them? Because they don't know. Parents, I can't even tell you how many parents were like, oh, they expire? Or they don't even know that they have a dose counter on there. Oh, they have a dose counter? The parents don't even know that. So the parents are also getting this education, because again, they're not always getting it, from their primary provider. So, that we're helping to provide that information. The student's able to describe the symptoms for the inhaler. When do you use your inhaler? Some kids are like, oh, some of them are like, well, I don't know, I use it kind of when I feel, you know, a little tight, you know, or you get different kinds of things. So then we're able to educate them. This is when you need to be using your inhaler. The student's able to demonstrate proper technique for self-administration of inhaler. How many of you guys have had to do that in health office over and over and over again, right? This is a and then they're done, right? So they have to demonstrate that they're able to use it the right way. The student verbalizes understanding that their inhaler is for their use only and should never be shared. The student agrees to assume responsibility to keep their medication with them at all times, and that's where the PE thing comes into, and we're able to say, okay, so when you go to PE, don't leave it in your locker. Make sure that you're taking it with you in your pocket, you know, in case you need it. Don't leave it in your locker, in your backpack. The student verbalizes knowledge of when and where to seek assistance for symptoms not improved after use of inhaler. So again, that's really important for them too, like, when do you go for help? You know, what symptoms are you gonna have? Who are you going to go to for help? How does that look like? And again, this form is signed by the student, the parent, and the health technician, so all of them are there. Next thing was to identify resources, because again, sending them to the primary medical doctor, you know, for that. So one thing was, I did work with Breathmobile. They're through Arrowhead Regional Medical Center. I worked with them with a pilot program up in the high desert many, many moons ago. So I called them up and I was like, hey, this is what happened. Can we get you guys to our district? So they were able to come over, and so they come about every 6 weeks. I think it's about every 6 weeks. They come to the district office. It used to be completely free. It is still free, I believe, for Medi-Cal and IEHP, but they used to see even people that had insurance, they would see them for free. Now, if they have insurance, they are charging them a fee, so they've kind of had to realign their things based off of like the grants and the things that haven't been received that they've had in the past. But they're phenomenal as far as everything that's on their van. If you guys haven't ever, if you see them around and you have a chance, we were trying to get them here today, but we couldn't get them here. But if you ever have a chance to experience it, they're a very, very valuable resource to have. And then I told you guys we were able to identify the pulmonologist. Yeah, Michelle?
So the Breathmobile goes to what cities or counties?
They're San Bernardino County. I don't know if they come to Riverside. I haven't heard of it. I believe it's just San Bernardino County. So I know we're in Riverside County. So I don't know if there's other resources in San Bernardino County that you could look at. But they are an invaluable resource, definitely for us. They've helped get our kids. They were uncontrolled because they do pulmonary function tests. The kid comes on there, they do pulmonary function tests. They have the child use their inhaler, do the pulmonary function test after that to see is that inhaler really working for them. They do allergy testing on board for like that area, you know, so they're not testing for just in general, they're testing for like the allergens in that area, like are there cottonwood trees or whatever they grow in that area and things like that. They have a pediatric respiratory nurse practitioner that's on board. Sometimes they'll have the pulmonologist, he kind of goes out and about. They have, I think they're MAs that are on there as well, that are there to assist them.
Do you know if they see kids, because like our district is really small, do you know if there's some like local in the area, would they see them from outside of the school district?
They could call, they could definitely call and ask, because I know like even like when we were first starting, we had so many parents that wanted to be seen, like they were having to drive to Colton to be seen the first time, but then the second time they could be seen in Yucaipa. They go to San Bernardino as well, they go to different sites. So, do you know, Michelle?
I do.
Yeah.
So it is by appointment, but they will take walk-ins if they have space available. But if you call today and you need an appointment right away because of the symptoms of your child, then they will say, well, we're not at your district, but we're at this one tomorrow. Can you get them there? Yes, we can see them. So as long as though they go to the desert, they go all over San Bernardino County. So if you're in San Bernardino County, then they will make you that appointment and get you in if you can get them to the different locations. So they do not have to be associated with your district.
Yeah. And like I said, this is just one parent's experience with the Breathmobile that I like to share. This parent she was like, I kept trying to refer her, and she's like, I don't need to go, my kid doesn't need to go. And then she finally made the appointment, you know, so she just says, I wanted to send you a quick email thanking you for your recommendation to have blank seen by the Breathmobile. We finally got him in over spring break. They were incredibly helpful. They helped fine-tune his current asthma plan and meds, and also taught us how to correctly administer everything. We were never shown the correct administration of inhalers before. In addition, they gave us extra Flovent at no cost. That med has been killing us cost-wise ever since January when our insurance stopped fully covering it. I didn't know what to expect when we went in. I was very pleasantly surprised by how helpful the appointment was. She made an appointment for her other child to be evaluated next, and says, thank you again for this recommendation and setting this invaluable service up for the community. So these resources, again, I know the doctor's gonna talk about like connecting. I was hoping to go after her, so we're kind of all tied in together, so I'm doing it backwards. But it's connecting, you know, you've got the school nurse, the provider, you've got the student, and so we're connecting them. And so we're kind of that person. We're connecting our parents and our students to these resources that they need to get the assistance that they need out there. So I talked to you guys about how informing staff on like how do you inform your staff that, you know, your students have, you know, allergies, asthma, other medical conditions. You need to work with your IT department because, again, every system's going to be a little bit different, but this is how we did it for ours. So our health staff, you know, when they come in before school starts, they run a query of all the medical conditions. They contact the parent or guardian to update the health information. And then they update and flag the medical conditions. So the way it works for us in Aries and the way they set it up, again, it may work different for your IT department, is under the medical history. We flag it under medical history. And so under medical history it says asthma. We'll put asthma, no inhaler at school. Asthma, inhaler in office. You know, asthma, self-carry, so that the teachers are aware. That flag, you know, it's up at the top as well, that red flag for those of you guys that use Aries. But what that does is that's what prints out on the teacher's attendance sheet. So the teachers can print an attendance sheet. It shows like kids if they have IEPs or 504s, it shows up on that same sheet. It'll have an M. So it doesn't say exactly what that condition is, it just has an M, because the thing we were hearing from teachers is, I don't have time to go through all the kids and see who has medical conditions. And yeah, I get that, but I would think the teacher would want to know if their kid had peanut allergies and things like that. And we can't give them, you know, we can't hand them those lists. So, so if they just have an M, they were like, oh, I only have to look at the kids that have an M? Yes, only the kids that have an M. So we've gotten really good feedback from the teachers. The teachers feel like they're better informed now of our students that do have health conditions, those kids with the asthma and the allergies and things like that. That way they can go into the health office and they can ask those questions. Yeah, Michelle?
I'm just gonna ask this one quickly, having worked with Aries a lot. Some of the student names are very long, and so it cuts it off before you even get to the first name, because the last name has 3 last names or something. So if they have a really long name and it's cutting off their first name, will it still give the M?
It's in a separate category, so it's like the name is over here, and then it has like IEP 504, and then it's a separate category. So then the other thing we did was training for staff. So I'm the only RN for our school district. I know you guys all have big caseloads as well, but I'm the only credentialed school nurse. I have almost 9,000 students, so I can't be everywhere, and that's special ed, that's pre-K, all the way through. We don't have, you know, severe and profound, but we do have mod severe. So I was being pulled in every direction, especially once we started this training. Hey, come to the staff meeting. Hey, come to the staff meeting. But I've got IEPs, I've got 504s, and everything else to do. So I was like, we're in the technology age. Like, why can't we do this stuff online, right? At least to get the basic stuff down, to get that information out there. So we did start asthma training for staff. We did do an e-training, and this came up because of field trips. I don't know if you guys have come across this as well, but you know, our students with asthma, they're going on field trips, right? And so what I found out when I started working with teachers is, A, some of them weren't even taking the inhalers with them because, you know, they just weren't. Or B, the teacher was taking them with them, had no training, you know, which is even scarier, so they don't know what symptoms to look for, you know, what signs, when to call 911. And then C, I found out that they were also taking that student, if they had their inhaler, but they were in group B. And so it was like, okay, well, you've got the medication, but they're on the other side of the amusement park. What happens when that student, you know, comes into those problems? So now the teachers, if they're going on a field trip, they are required to do, if they've got kids with EPIs, they have to do the EpiPen training. And if they have kids with asthma, they've got to do the asthma training, and that student has to stay in their group. So if they've got the meds, they know they have to carry it on them, they're in that group. We did get pushback from teachers, as you guys know, because it has to be voluntary, right? Well, guess what? Our district was like, okay, well, we have substitutes that are willing to work. So the substitute's willing to do the training. We're gonna pay the substitute to go on the field trip, and you get to stay in your classroom for the day. So guess what? Our numbers went way up. Our teachers really started like doing more of the trainings. And then once they kind of understood it, they were more worried about liability. I mean, you have to think too, I mean, we had this incident happen in our district. And so a lot of our staff members were on high alert. They were scared, you know, they kept hearing, you know, well, how liable? You know, that kept coming up, going to the union. Am I gonna be liable? What happens if something, you know, goes wrong? So we did start this as this e-training for our staff. And let me try to see if I can bring it up for you guys. Yay, all right. So again, it's a work in progress, no judgment, okay? So this is kind of the website that we've designed, and you can see over here on the left, what is it? There it is. Our e-training. Oh, sorry, that's our common illnesses. Okay, so we have our that's not what I want. I want the e-training. So there's asthma. All right. So it's on the sheet too. She included it in the handouts that she sent out ahead of time. So this is basically what it looks like right here. So they watch what is asthma. Again, with our teachers, short and sweet, right? Because they have a shorter attention span than our kindergartners, I think. So it needs to be short and sweet, but they need to get that information out there. So the first one they watch is they watch the YouTube on what is asthma. It's, I don't know, 2 or 3 minutes or something like that. Then they watch how to use a meter dose inhaler, because our teachers, if they're the ones administering it, they need to know how to do it. So they watch that. And then they get the handout that you guys have. It just talks about like what to do in an emergency, like signs or symptoms to look for. They do that. And then there's a quiz that they take. Let's see if I can scroll down. So they take the quiz. They take the quiz, again, short and sweet, right? It's like 5 questions or something like that. All right. So, and then when they put their name at the bottom, it says, I acknowledge that I've watched the above videos and I've had the opportunity to ask questions. I understand that I must keep the inhalers on my person at all times, and if medication's administered while on the field trip, I will document on the paperwork provided. We give them just the papers that go with them since they're not using Aries, and then they type their full name. Being on the Google like this, it actually goes to the district. We have an Excel spreadsheet. So like today, one of the secretaries called me and she goes, hey, I have this teacher going on the field trip. Has she done her training? I'm able to type in the school name, and all the teachers that have been trained for that school pop up, and I was able just to look and see if she had been trained. You can, you know, search it by dates and all that type of thing. So it's a really, really helpful thing to have. We also have EpiPens. So there's a video, and I hate being on video, but basically it's like if I was here teaching. So we had our public information person from the district. He came over and he basically like videotaped me. We did a whole little reenactment of a staff member having an allergic reaction. I had to run and get the EpiPen and, you know, all that type of thing. But at least they can see it, you know. So they have that, and again, there's a quiz that goes with this one as well. And then we've gone on and we're working on medications. There's one on seizures. Where we have the videos for seizures, and then there's a quiz that they take for that too. So, and then, I don't know how many of you guys are doing the Narcan training. So we've got the Narcan training as well. So we're kind of building this, this platform for them to do the e-training, because I'm just one person. I can't be in 5 different directions as we go. So, let's see, escape from that. Out of it. I'm almost done. Okay.
So if I use that QR code and I go over there, it'll let me open up all your different
Yes.
video trainings?
Yes, yeah, so if you guys use the QR code, then it'll open it up and you can see I did open it. I did have them, because usually it's locked just for our district, but I was like, hey, I'm doing this training. Can you at least like open it for him? So I don't know when he's gonna close it, but yeah, if you guys wanna go in there and just like, just no judgment. I'm not going for an Academy Award on my videos, okay? No one likes to be videotaped, right? Yep. And then I know the doctor's going to talk a little bit more, but this is just a website you can go to if you guys are looking at going to the stock albuterol program. This is kind of the toolkit that we're using, which is the same one I saw in her slides as well. So it's really good information to have. And then, any questions, you guys? No questions?
That's great.
All right.